We're back on.
No. Have you ever gone to professional football games? Did you ever see them just stop for no reason in the stadium? Well, what they're doing is that they're gone to commercial, right? So that's what we're doing here.
Commercial.
We're going to commercial while she changes
Just
the
in case I
tape.
have YouTube issues, I'm limiting it to 13, 14 minutes. Part 2.
Tell me when you're starting. so
I'm
I-
started.
Oh, Lord.
We got you dancing. Just don't fall off your shoes, okay? Okay.
I did that once. I was students in New York. All right. Everybody raced up to help me. That was so sweet. There's your review of systems. Okay, it's all outlined here. You just write underneath that whatever you find into that H&P. So it's all divided up for you to see. All right. Here we go with this. This is your current provider orders. And this needs to be filled out both at the facility and at home. Now the first column says, what are the orders? This is what you're going to find in the doctor's orders section of the chart. So what we need to know is what kind of diet are they on? Is that a doctor's order? You betcha. Are they on intake and output? Yes. What is their activity level? How often do they have vital signs? Don't write their vital signs in there. That's not what this is for. How often? And if you don't actually see an order for vital signs in long-term care, you might not. And so that would be per shift. You can just write that in, per shift. Because a lot of these people have been there for a long, long time. Now, you won't run into that when you go into blocks 2, 3, and 4 because you're in acute care, and there will be actual orders for vital signs. Okay, every hour, every 2, every 4. God bless you. So that's what you're going to write. And again, if you can't find an actual order for how often to do vital signs, just write every shift because they're at least done that way. All right, we'll go down to more of this. Treatments, are they on any wound care? Do they get any kind of special treatment? Okay, so that's where that section would go. Are they on glucose, their blood glucose monitoring? So do they have active checks ordered? And if they do, how often? All right, so it could be AC and HS, right? Once a day. So you would write that down. And anything other that you find that you need to write there, there's a spot for that. It could be physical therapy. Maybe they go to PT. And so that would be something else you could add. Now, if you go back up to the top of the paper, you're going to find, what does it say? Physician order, patient order. So where do you find all that? Do you find that at the facility, or do you find that at home? So that side, I want you to write, get this information at work. Now look at the next column. The next column says, what's the significance of this to the client? That you do at home. Yes, you're right, Wendy. That's exactly what you do at home. Now you got to go home and think about it. Maybe under the medical diagnosis you wrote diabetes, and now you're seeing that there's blood glucose monitoring ordered. Does it start to fit together? Then you can write the significance to the patient is because he's a diabetic, you need to understand what their blood sugars are. All right? So anything that you think of as the reason that it's significant to that patient is what you write there. That is something you're piecing together when you're trying to put this person together in order to be able to treat him correctly. All right? Any question? So that piece is done at home. Okay, so now we'll go on. Medication. Boy, I bet you have a lot of this, right? Got a lot of sheets of this? Okay. The first column, generic and trade, please, like I told you in Intro to Pharm in Module 3, please write both. But write both the trade name and the generic name, because it has happened every rotation I've had, the doctor comes and writes a trade name, okay? So the order on the doctor's order sheet that you're looking at says Lasix, and then you look at your MAR and it says furosemide. And you go, I don't see Lasix. Right? I don't see the order for that. So in order for you to be able to catch that it's the same thing, you need to write both names. Then you're going to write the pharmacological chemical classification. So if we're talking about digoxin, we can say it's a cardioglycoside. If it's, all right, Lasix, we can say it's a loop diuretic. Okay, where are you going to find this? Do you just know that? Yes, in your Davis Drug Guide. So what part of this are we doing at the facility? You are writing down the names of the drugs the patient is currently on. Not the stats, not the one-times. I want routine medication and PRNs. Because you could be taking care of your patient, it's your turn to pass meds, Julie, and your patient has pain. And the nurse goes in the narcotic box and gets out a Percocet and hands it to you. But if you haven't looked it up and you can't tell me what it does, you can't give it. Okay? So make sure you add the PRNs to this too. So at the facility, you're writing down the drug name, and even if you only have one, just write the one name. The dose, the time, the route, that is the part that's gotten at the facility. Now, when you go home, you're going to look up the drug. There you're going to find the other name to it, so you have to add that. Then you have to go and find the pharmacological chemical classification, and you add that. And then you're going to look down, and in the drug guide, whichever one you use, it's going to give you dose ranges. And so you can look at your dose and say, oh yeah, that falls within the range. So it says, is it a safe dose? And you write, yes. All right, assessment and results needed before administration. That you can also find in the Davis Drug Guide if you don't know. But what if that was insulin, what I want to put in that little box? What's the blood sugar? What if it's an antihypertensive medication? What do I want to put in that box? The blood pressure. Got it? So that's what would go in that, and you can find it at home in your drug guidebook. Significance to the patient. This is when you have to start putting all this stuff together. We have somebody, remember that guy with the EMI? Right? Remember he had a heart attack, he had an EMI? Well, now you look up and you find out that he is on digoxin. And so then you look in your drug guide and you think about it, and you need to take this crossword puzzle and start putting together to figure out why somebody with an MI might need their heart to beat stronger. Right? So you're going to see that in your drug guide. And then you're going to write that down. You're also going to see that with an MI, they can develop failure. Heart failure, right? Because it's been damaged. Maybe that's why they're on a diuretic. So these pieces begin to come together in your head. Do you see the method and the madness behind all this? All right, and then what else do we have over here at the end? Nursing implications. What therapeutic and or adverse effects will you watch for? So what's the side effects of the drug? Where do you find that? In the drug book. So what do you have to watch out for? Well, if I'm giving this guy digoxin, what if his heart rate slows down to 30? That would be something that would be bad that I need to watch for, right? Because digoxin causes your heart to beat stronger, but also slower. All right? So that really is where the side effects come in. The warnings. You find it under what nursing has to watch for in that drug guide. Yes, ma'am?
Sometimes there's a lot of side effects. Do you want us to write all of them?
No.
No.
No. The ones that you think, if it's in red, most of the books, when they're really bad, have it in red. I certainly would include that.
If we're only supposed to be picking 2 disease processes, correct? Or are we also supposed to put the medications that don't have anything to do with those disease
No,
processes?
every med.
Every med.
Because you'll be giving all kinds of medication, irregardless of the diagnosis. For an example, long-term care, they're usually on cholates. Okay, it has nothing to do with their diagnosis, it has to do with their immobility. And so they're prone to constipation, which you're going to hear Professor Nelson teach you about not too long from now, on mobility, immobility. And one of the big things that happens when you're immobile is you get constipated. And so they like to put everybody on colace at these facilities, and it won't have anything to do really with their, diagnosis. These are good questions. Now, what if, and some of you go, oh, what if I can't find it? What if I don't understand it? This is kind of tough. I've never done this before, right? Take a deep breath, let it out. Look at your instructors around here. You got 3 of us in here. We are there to help. That's what we do for a living, okay? And we will help you start putting it together so it makes sense to you. All right? We understand you haven't studied med-surg, but you're going into a clinical atmosphere where people have diseases, and you are put in a situation where the concepts you learned in fundamentals are important, but now you also have to look at disease processes that you really don't get until block 2. But you've got to know these disease processes as far as it goes with your patient in order to be a safe practitioner for this patient, right? So we will help you put the puzzle together. We will spend time in our rotations with each one of you, all together and privately, and we will discuss this stuff, okay? And please don't be afraid to ask us, because that's what we do. She almost fell over that.
I know.
See that?
Be careful.
She's trying to trip him. Any question? Okay? All right.
This will be a good time for break.